Sally, can you tell me about Landmark Health Systems?
Absolutely, Mercedes. Landmark opened approximately 8 years ago. We have expanded our services, have moved locations. We are currently located at 387 Franklin, right downtown in Buffalo.
And would you say that the stigma over the last 25 years has changed at all?
Again, the stigma regarding mental health and substance abuse definitely continues. One of my biggest missions throughout my career has been to provide education, support, awareness, and also, additional techniques and discussions for families or with families to help them to understand, more importantly, if they're struggling with a loved one or a friend, somebody that they know at work, whatever, regarding mental health and substance abuse issues.
Why is it important for family members and loved ones to understand?
There's this stigma that continues, and individuals who are not experiencing those types of symptoms sometimes have a hard time understanding why somebody could be experiencing, for example, major depressive disorder that's recurrent. This is something that people don't choose. And so a lot of times family members, friends, coworkers will ask questions and say, how could someone like you be depressed? Why? You have a great job, a great family, etc. And it's very confusing for the person who's experiencing those symptoms as well, because it's not something that they, appreciate having.
Jared, you're one of the first faces that people see when they walk in.
Yes, and we've designed it that way on purpose. I mean, yes, we do have really excellent front desk staff, and we really want people to kind of communicate with us even before the first appointment, get information on what medications they've tried, things like that. I read every single thing that they fill out ahead of time, and then when they show up for the appointment, I or one of my nurse practitioners who I've worked with for years will be the ones to see them. But most of the time it's me. And so right from the start, we work on getting a personalized treatment plan for each person. That's one of the things we pride ourselves on here.
Yeah, and that's very neat. So you have specialty programs for individuals who have had a history of treatment-resistant depression, right?
Yes. So that's the official term. So if you were going to Google it, treatment-resistant depression would be, we prefer to refer to it as just severe depression or depression that affects people's functioning. Most of the time people have tried something already by the time that they get to us, whether it's diet and exercise, whether it's antidepressants prescribed by a primary care doctor, let's say, or counseling. So that's where the treatment-resistant part comes in, but it's not that the person is resistant to treatment, it's the fact that not every type of depression responds to medication and traditional counseling. And so that's why we offer services that are, they're FDA approved, evidence-based, which means they're covered by insurance, but other places in Buffalo don't really offer them. So for example, one of the personalized treatments that we offer that many places don't, we're one of the only ones, and we pride ourselves again in keeping on the cutting edge of evidence-based medicine. So not going off on a limb on our own, but things that are FDA approved, covered by insurance. So transcranial magnetic stimulation, it's a mouthful, so we just say TMS, is our most successful treatment option that we have for people with severe depression. And we have roughly 50% of patients that undergo this treatment go into full remission, which a lot of people with chronic depression don't even realize that's a thing. A lot of doctors don't even say it as a goal because they don't want to get patients' hopes up. But I have yet to have a patient that did not get better in regard to depression as long as they didn't give up, as long as we kept trying other things. Because it's not just the TMS, we have other treatments, we will figure something out. We'll go back to the drawing board if we have to.
So how can someone reach you?
We can be reached by calling 716-462-0284. And individuals can request an appointment, request information about our services. We also welcome other agencies or offices who would love more information on our programs. We would love to come in and just do a presentation, and that way if you have somebody that you would like to refer, we can help link them with services.
And there's more information on Landmark Health Systems, located right here in Buffalo. Give them a call, 716-462-0284. And we'll be right back.